Another person has briefly escaped from a managed isolation hotel in Auckland after tailgating a staff member. The man attempted to follow a staff member out of the gate at the Crowne Plaza, claiming he was a worker, but only managed to make it about 50 metres or so. He had arrived from Brisbane yesterday and has yet to have a COVID test, but has now been charged over the escape. The incident comes after one new case of COVID-19 in managed isolation today, and 90 days since a case was acquired locally and from an unknown source. Nita Blake-Persen reports.
It was a brief bid to make it beyond the Crowne Plaza hotel in Auckland for the 32-year-old returnee. Witnesses say authorities were quickly onto him.
And then the police just come up and turn them around, put some handcuffs on them and walk them back.
Yeah, his mask is still over there.
Hope someone picks it up, it's not going to be me anyway.
The Minister in charge of managed isolation, Megan Woods, says he didn't make it far.
This isn't someone that just simply wandered out the front door. They saw an opportunity of a staff member leaving the facility who had to go through the fence and essentially tailgated out there. What I take a great deal of comfort from is that the systems worked, this was observed and he was immediately brought back in.
She says police handcuffed the man and brought him back. Authorities are now investigating to see if any contact tracing has to be done. Elsewhere in the country, there was one new case of COVID-19 in managed isolation, a woman in her 20s who had travelled from Ireland via Dubai. Her positive result was from day 3 testing, and she was transferred to a quarantine facility in Auckland from the Ridges in Rotorua. But beyond managed isolation, the Minister of Health, Chris Hipkins, says daily test numbers and the 7-day average have consistently lagged behind the target of 4,000 people a day.
The testing numbers in the community are still not at the level that we are aiming for, and we do need more to be done in that area. So while we've issued new guidance to GPs and we're continuing our focus on testing at the border and in isolation and quarantine facilities, we're still not seeing the numbers overall that we want to see. So one of the issues that we are facing, and let's be frank about this, is that people are reluctant to be tested. And that is something that we all need to play our part in. My message to all New Zealanders is, if you're offered a test, you should take asked to be tested. You should take the test.
The Director General of Health, Dr Ashley Bloomfield, has confirmed that a second test of the man who tested positive in South Korea after leaving New Zealand was also positive. However, he said all testing of contacts in New Zealand that had returned tests had been negative.
Right from the start, we have been considering 4 possibilities for this case. First of all, it may have been a false positive result. That's now been ruled out. The second is that it may have been an old infection that has returned a positive result, and we have seen those here before, and they have been widely described internationally. The third is that the case acquired their infection during their travel from New Zealand to South Korea, in particular during quite a lengthy transit period in Singapore. And the fourth is, of course, that the case may have acquired the infection more recently in New Zealand, and the latter is the one we are working to rule out.
Dr Bloomfield said further surveillance testing was being done to rule out the possibility of community transmission around the case.
We also want to do some further surveillance in the 2 places where we know the person has been in the 3 weeks or so before they left New Zealand. That is in South Auckland, particularly around Manurewa, and also in Queenstown. So I am suggesting that anybody who has been in Queenstown from the 1st to the 4th of July, a very short period, and this was before the school holidays, but anyone who's been there who may have had or has symptoms or may be concerned, please do get a test. And likewise, if people in Manurewa have symptoms, you will be offered, you should seek advice and get a test, and others who may be concerned, please do reach out.
More than 460,000 tests have been taken so far, about 9% of New Zealanders. Mō te hōtaka o te ahiahi nei, ko Nita Blake-Persen, aho.